Is AI going to replace all HIM professionals in the next few years? Well, I asked this question of my next guest, and you're going to want to stick around for his answer. Joining me on the program today is Mahmoud Suleiman. He is the CEO and Registrar at CHIMA and the Canadian College of Health Information Management. He and I talk about the impact that AI is having, what's happening in terms of policies here in Canada, and the future of where he's going to take CHIMA, the organization. I can't wait for you to hear his very thoughtful answer on how AI is actually going to help HIM profession in the future. Let's get to it. I'm really looking forward to getting together with you. We are here in beautiful, lovely Halifax. But before we dive into talking a little bit about HIM in Canada, Mahmoud, can you please introduce yourself and tell us a little bit about the work you do?
Absolutely. So I've been with CHIMA now for about 2.5 months. So I come into the background as a healthcare professional, as well as a regulator, and coming into the new association world. I've recently become a certified health information professional myself through our experiential pathway. And it's an exciting world that we're in. And I was looking for an opportunity to be engaged in a profession that really allows the integration of healthcare and the technology towards what matters, is really improving the quality of care that patients receive.
Well, as a newly minted information specialist, can you tell me a bit about what that was like for you, learning that after so many years being in healthcare?
So I'd say that throughout my career, I've always continued to go back to school and further educate myself on different things. I did focus on health administration, did focus on law with innovation and technology, and I was looking for something which allowed me to bring it all together. And so that's been a fantastic opportunity, and to get a better sense of what's involved in the health information profession, where in the past we know that its history is really around medical records, but now has evolved into being such a wide and versatile type of profession. And so when I was able to come in as CEO and Registrar of CHIMA, it's been a fantastic opportunity for me to bring that all together.
And as CHIMA, and from your just personal experience, what are some of the challenges that HIM professionals or the HIM segment is facing right now in Canada?
I'd say there are a number of challenges that we're faced with and that we're dealing with. One is looking at what is the level of awareness of health information professionals. When you ask the average person, what do they do? It's not clear for people and not always easy to explain what is a health information professional. And when you think about what is a simple way to describe it, that's typically been a challenge for this profession. And it's how do we actually brand the profession in a way that's tangible and easy for people to understand. So when we talk about professionals who are involved in ensuring that there's quality access to accurate data that's secure and accessible to those that need it, both in terms of the health professionals who are going to provide individual care to their patients and their communities, but then to policymakers who are really leveraging that to ensure that they make appropriate decisions for the healthcare system to ensure that it's sustainable for generations to come.
When you talk about access to information, like, who are you talking about in terms of access to that information?
I'd say partially it's if we're looking at the individual patients themselves, because it is important that they actually have ownership of their own data and their information, and they understand where they are in the system itself and how they're managing their own outcomes. But then the healthcare providers who are making such crucial decisions about the care that their patients receive, but then also policymakers, whether they're governments, any other type of funder, insurance companies, and so forth. It's important for people to be making data-driven decisions, and so we want to make sure that they have the quality data there.
And I think that's sort of a big misnomer, I guess, when people talk about HIM, especially for those that are in the industry. I think it's synonymous, or used to be synonymous, with coding, right? Mm-hmm. And that was all that these folks do. But you're talking and highlighting very appropriately that it is much more than that. It is about access to that information for more than just the billing side. It's for making decisions, as you just said.
Absolutely. And I think it is really trying to elevate that and what are the different opportunities that exist within this profession. And it is so diverse and the opportunities are endless. And that's what we're really starting to see in our membership, that we have people in a variety of different types of roles. Yes, there are a good number that are coders, but we're finding there are people part of clinical documentation improvement, release of information. We're looking at individuals who are at the governance levels of aspects and looking at, as chief privacy officers, chief information officers. And it's great to show that wide spectrum of what opportunities are available to our professionals.
And now one of the things that CHIMA does really well for its members is, of course, keep its eye on the various policies that are coming through the various levels of government that affect HIM. Are there any policies or any rumblings of policies that you're keeping your eye on?
I think there always are things, and there's a benefit that in our organization we actually have two arms. One is as the association to advocate and promote the profession, and the other side is a professional regulatory college to ensure that we have our professionals who are competent and are practicing at the highest level of ethical care. There's important immigration policies that are being undertaken that we're mindful of because it does impact the pipeline for students who want to be educated in Canada within the health information profession, but also have opportunities to work here afterwards and contribute to the Canadian healthcare system. So we're actively engaging with federal government, but also provincial and territorially as well, to make sure that we can raise the importance of health information professionals within this landscape. The other aspect on a more positive contribution is around the government's work around an AI strategy. And we recently had the federal government release some high-level components of what that is. And while there is a large focus on healthcare and health data, us as being promoting the workforce itself are valuable participants within those conversations and really going to make sure we're at the table to have those discussions.
Well, I'm glad you brought it up because we can't have a discussion in 2026 without talking about AI. And specifically, we've heard rumblings, bold statements made by some folks that say AI is really going to replace HIM, but we've heard repeatedly here and at other conferences that is simply not the case. Where do you fall in terms of AI and how it will help or hurt the HIM space?
I think every profession is at risk of fearing for change, and I think that's normal. I think there's always an identity crisis that comes out when you talk about AI and what that means to your profession. And the health information profession is not immune to that. The key aspect that we look at is how do we actually integrate these technologies into our work? And it takes part of it being, as a professional, ready and willing to embrace these changes and finding opportunities to both evolve your existing role into something that encompasses these technologies and hopefully allow health information professionals to be working at a much higher level. But then there's going to be new roles that are going to come out that we still don't know what they are just yet, but we're actively at CHIMA working towards an AI strategy and have assembled a fantastic advisory group that are made up of academics, vendors, policymakers to really help to support what this future could look like, and so that we feel that there's a path for how we can actually achieve that effectively and evolve the health information management profession into the 21st and 22nd century.
Well, I've heard repeatedly that HIM professionals, clinicians, anybody who's using AI in healthcare, it's not a case yet that anyone's being replaced, because we know that there is way too much work for the professionals we do have. But it's more allowing people to practice more at the top of their game, right? To really be able to focus on the exceptions, the things that do require that cognitive thinking, whereas the AI today is handling a lot more, perhaps, of the mundane, the rudimentary, the repetitive tasks. And that, to me, sounds like a good thing to do, is to get rid of those types of those types of functions off of the high-value people that we have in healthcare.
Absolutely, and it's really aligning the type of work with the people who are qualified to do it. And again, where we can actually have those repetitive activities being automated and done through technology, by all means, because again, our professionals are educated and trained to do much more and are at a higher level. And so it's going to be a switch in the focus in terms of what is the work that they're looking at. Is it the more critical, complex types of activities that they're engaging in? How are they ensuring that that quality piece is still integrated into the work? Because again, if we have poor quality data, we're going to have poor quality outcomes. So making sure that they're able to still have their eye into the work that's being done, and the concept of human in the loop and human participating in these activities is never going to go away. But again, how do we continue to evolve and get into a higher level space where there is oversight in a different way in terms of the activities that these technologies are doing? And that's going to be a key role for health information management professionals.
We started at the top mentioning that we're here in Halifax. Of course, we're here at the CHIMA event. Tell me what people can expect coming out of this event. I've certainly been educated in the sessions I've already been to, but what is your hope that people attending this or maybe hearing about this later will take away from today?
I think it's been a great opportunity for us at Health Information Day really to bring together thought leaders who could share their different experiences of working within health information from different facets and different perspectives. So we have clinicians here, we have people within the policymaker perspective and those that are actually doing the work, a lot of our members, and thinking about how do we actually see this as a joint effort to make effective change for the healthcare system and our individual patients. And so it's really allowing for people to expand their perspectives and to have a better understanding of how they can actually contribute to move things forward in the right way. And there's fantastic conversations happening as we connect into e-health as well. And so our opportunity to collaborate with Digital Health Canada on that is quite important. And we value the opportunity to bring together all these people and have these fantastic conversations, which will help to bridge further bonds and connections over the weeks, months, and years to come. And I think really demonstrate the high value that health information professionals have within the healthcare system.
Mahmoud, where are you going to be taking CHIMA? What can we expect from CHIMA over the next few months?
So I've been with CHIMA now for just under 3 months and really just trying to get a lay of the land and where it is that we can have the greatest impact on the profession and on the organization. I do come to CHIMA and there's already a lot of presence of optimism within the organization for how we can move forward. And so really it is going to be making sure that we can bring greater awareness to health information professionals. And I'm really key to build a lot of bonds and engage with different individuals, both within our membership and those outside. We have a lot of different partners, and we know that we have our educators that we engage with a lot, our vendors and government officials as well. And that's going to be key for us to really allow us to make a greater impact on the profession within Canada. And alongside with that, we do want to make sure that we're really acting what was expected of our own profession, to be making data-driven decisions. And we want to make sure that anything we do related to AI is grounded in objectiveness, and anything that we do within AI is grounded in objectivity, and that we can present our case effectively for how to move forward. We're also key to do a health information workforce study, both within our membership, but then also the broader non-certified professionals, just to ensure that there's a good sense of what do we need to be able to fulfill the roles of today and the future, and really looking at a longer term horizon about in the next 5 to 10 years, really to help to inform policy decision making at the different levels, including with employers, so that there is a very positive way forward for our profession.
Well, I like how you highlighted that, and I like how you brought up AI in this conversation, because without good data, that AI that we're building right now is not going to be very good, right? Because AI is so data intensive. So HIM professionals, to me, play a key role in ensuring that the AI of the future is well grounded in the actuality of healthcare, not sort of bad data that we have kind of in a lot of places in healthcare right now, right?
Absolutely. So the whole concept of garbage in, garbage out in technology kind of still plays here. And we want to make sure we have quality in so that there's quality out in the end. And it's key for us to have great health outcomes for our patients and the public.
Well, Mahmoud, you've shared a lot of great information with us today. Where can people go to learn more about CHIMA?
So I encourage you to come to our website to learn more. So we have healthinfocanada.ca. There's an opportunity to kind of learn more about the health information profession, some of the resources we've created, including a health data literacy tool, which is built for the public, the general public, so they can engage with that, but also any other professional who feels like they want to build out their knowledge in this area.
Yeah, and that's something we actually didn't mention, and I should have mentioned it off the top. That is a great tool for anybody who wants to become more health literate. I found the tools on that site just to be fantastic. So definitely would encourage anyone out there to go to those.
Absolutely. The more we know, the better we are able to deal with the data, and I think everybody needs to be empowered to do so.
Well, I really appreciate your time today. Really enjoyed having you on the program.
Thank you so much, Colin. I appreciate the time and appreciate Healthcare IT today meeting with us.
Hey, I really want to thank Mahmoud for joining me on camera today and talking about his view on the AHIM industry here in Canada. I really appreciated his comments around how AI is really going to help the overburdened HIM professionals, and the fact that we don't have enough professionals in the first place to do all the work we have here in Canada. So AI can only help. And I also appreciated how he's taking a look at some of the interesting things in terms of policies, and they're not all 100% focused in healthcare. He was talking about the immigration policy and how that will impact Canadian healthcare and the Canadian healthcare system. I thought that was very insightful. And hey, if you enjoyed this episode, please mash that like button and click subscribe. Also, head on over to healthcareittoday.com, where you will find more great content like this. I'm Colin Hung here in Halifax, Nova Scotia. Thanks for watching, and I'll catch you on the next video.